Hello, everyone, and welcome to another edition of Be Well, Be Whole. And I have with me today my friend, Dr. Beth Schissel. And today we're going to be talking about best practices for families, particularly families, COVID-19, and families with children who are not able to get vaccinated. So we're going to dive into this very important discussion. All the children are back in school. And I don't know about you all, but where we are, just about every other day, we get a notification of another positive COVID case from the school, and it's concerning. And so Dr. Schissel here is going to help us think about think about what we can do to protect our families and protect ourselves. So Dr. Schissel, thank you for being with us. I'm just going to call you Beth.
That works. I tell patients that I'm Dr. Beth. It's a lot easier. So
Dr. Beth.
I'm even Dr. Beth to my nieces.
Nice.
Then they shorten it to DB. So they've done that since they were little girls. Yeah. Now they're grown.
Okay. DB, Dr.
Yep.
Beth.
Yep.
Tell us a little bit about yourself and what you do in the field of medicine.
Yeah, I'm actually a pediatric emergency medicine physician. Which I did a residency in general pediatrics and been boarded in general pediatrics, and then did an additional 3 years of training doing pediatric emergency medicine fellowship training. So I only work in a hospital in an emergency department setting, taking care of sick and injured children. Mm-hmm. It's humbling when families ask if I have a practice somewhere, and I say, well, that makes me feel great, but no, this is what I do. I work in the ER.
Mm-hmm. So. Was that by choice? How did you come to work exclusively in the ER?
Well, that's a good one. The funny story is, as a resident, I hated my pager. So
okay.
I learned that very quickly. And I actually really like sick medicine. So I like the challenge of taking care of sick children, sick medicine. I'd considered potentially doing critical care medicine or even cardiology with the complexities of children and congenital heart disease, babies that are born with heart defects. Mm-hmm. But ultimately decided on the ER because it gave me a breadth of things. There's stuff that I do that's very much bread and butter general pediatrics, but there's also sick and injured. There's trauma. I take care of kids with traumatic injuries, car accidents, unfortunately in this, gunshot wounds, etc. Mm-hmm. But I like the challenge of taking care of very sick kids. And I think I went to the Air Force Academy undergrad, and I think that background of being able to make a decision without a lot of information and make a best decision and move forward and kind of test the hypothesis. And if I have to change, I change. I'm very comfortable in that arena. So that actually made sense for me. I don't like sick adults. I learned that in medical school. I mean, I think everybody learns
kind of make those decisions.
Yeah. I like the fact that 99% of what happens to kids is not their fault. So they usually, they don't want to be sick. They didn't want to break their arm. They just want help. They just want to get better. So I enjoy that population. Kids are very resilient. And so they're fun to take care of when they're really sick, but when you can turn them around and make them better, and, send them home with their families, that's a huge, huge thing to me. And I knew that I didn't want a pager and I didn't want an office practice. Mm-hmm. So part of that, though, the trade-off for that is that I do shift work. So that means that I work, and my shifts are anywhere around the clock. And obviously we cover the ER 24/7, 365. So I do kind of a weird schedule. That's the downside to what I do, but I like what I do as far as taking care of sick and injured kids.
Yeah.
Yeah.
And so being in the emergency room, you see everything, no doubt.
Yeah.
Particularly in the area in which we live. What are you experiencing in the emergency rooms presently and the most?
Unprecedented numbers of children coming into the emergency room. We are seeing volumes of children showing up that are about at the level that we saw a few years back when the flu season was so terrible in the middle of winter. But we're actually seeing respiratory viruses that we normally see in the winter. We're now seeing viruses that in me and you would cause a cold, but when you're an infant or kids under 12 months of age tend to have respiratory issues with the virus rather than just a runny nose and cough. So we're seeing a lot of that on top of the fact that we're seeing patients coming in wanting COVID testing, kids with COVID, and on top of our regular summertime season trauma. Kids break their arms, kids are out playing. Unfortunately, kids being hit by a car in their neighborhood, car accidents, the standard trauma stuff we're seeing, but then we're seeing on top of it all this viral illness and fear. And I understand the fear for folks with kids, but we're seeing those families too. Our volumes are almost 70% higher than what we were seeing a year ago at this time, which is just remarkable.
70% higher.
Just about. I rounded up. I could have rounded down, but I rounded up.
Mm-hmm.
But yeah, on a daily basis, we're seeing those kinds of volumes.
And how are children faring? I'm going to go ahead and just get to it. How are children faring with the virus, COVID-19? How are children doing?
Well, there's a wide range. So you have kids who just, and even a year ago, March, when all this first started and we didn't have testing kits, we had kids that basically simply had what would look like a common cold. They'd have a fever, runny nose, and cough, and they would test positive for COVID, although we weren't testing those kids at the time because we didn't have test kits. We basically were having to tell families, assume that this is COVID and then behave accordingly as far as quarantining, staying home from school, at that point in time, the CDC was recommending as long as 2 weeks. Now we're down to 7 days because we've learned more about this virus as time's gone on. And I think that's an important thing for people to understand. Science is an evolving process. Everything that's happening with this virus, we're learning on the fly, learning on the go. So what's important is we were telling folks to just, stay home. Now we have kids coming in that just have a runny nose and a cough and they test positive for COVID. They don't have any respiratory issues. They're staying hydrated. They can go home, but going home means quarantining. It means, and quarantining is real deal. I tell families, it doesn't mean you go out to the grocery store. It really means like last March when we were telling people stay home and only go out for necessary things. But if you've got a case of COVID in your house, no matter how sick or not sick that child is, groceries got to get delivered to you. You need to not be going back out. And that 7-day quarantine time is important. The other really important thing.
And that quarantine is for the whole family?
Yes. Yeah, absolutely. Absolutely. It's very hard to keep your 3-year-old in a room by themselves, right? It's one thing if an adult gets sick in the household and you can kind of keep them quarantined, but the rest of the adults should also try to stay quarantined too, because you can become a carrier and not know you're a carrier. We know that you can be a silent carrier of COVID. We have learned that in the process. That's why if you've got a case in your house, it's your house. It's everybody. Contact tracing isn't really happening, but if you've got it, but you should give a call to your family, who you were around, or who were you around in the last few days when all of a sudden you got sick. The other important thing that we had to tell people and learn was, if your child tests positive for COVID today, there's no retest that gets them safe to go back to school, because you can continue to test positive for up to 3 months. That's why the quarantine phase is what's important. So we also are seeing people coming into the ER wanting a return to school test, and there's no sense in running it. It's going to be positive. So what we're telling folks is, the 7-day quarantine, and after that, being able to go back to school, back out in the environment, you're no longer contagious to others. So that's a big message.
But I also understand that when I hear you say that, we should also have on masks still.
Oh, yeah, 100%. The CDC and the American Academy of Pediatrics have been absolutely, consistent, especially the American Academy of Pediatrics, for children to be masked, because right now, with the FDA approval, not just emergency approval, but the FDA approval of the Pfizer vaccine, kids 16 and above are safe to be vaccinated. Going down to age 12 is still within the emergency release for the vaccine. And obviously the studies are still ongoing, and eventually we'll see that being approved. But, that's why all those kids below the age of 12 that can't be vaccinated, they're protected by mask wearing. It's really, really important for everybody to be in masks. It's huge. I'm still in a mask. I'm vaccinated. I was vaccinated early on as a healthcare worker, and I still wear a mask in the grocery store. I still wear a mask at the post office. I don't go out to eat in an indoor facility. I mean, I'm still behaving as I did at the early onset of this.
Yeah. What are other?
It's not fun as it is.
Right. Thank you for saying that. What are some other best practices for that the population, the significant population of children who cannot get vaccinated yet?
The most important thing is for everybody else around them to get vaccinated. Right now, 43% of the population is not vaccinated.
In the United States.
Yeah. Some states have done better than others. And some states in the South notoriously actually is low. And the big thing I try to tell folks about the vaccine is, it's not political. It's really about your health. It's about the health of your community. It's about the health of your neighbor. If you personally say don't have any dependents, and you want to go jump out of an airplane and your parachute doesn't open and you die on the spot, that's your choice. You chose to do that. When you choose to not vaccinate yourself, that actually affects other people. It affects it affects these kids that can't be vaccinated, that we need them to be back in school. That's where they belong. They need to be learning and socializing. School is as much important for their mental health as their learning and their physical health. You vaccinate yourself because there's folks out there that are immunocompromised that can't get a vaccine. There's people getting cancer treatment. There's people that have rheumatologic diseases that are on, immune modulating drugs that make their immune system not as strong, but it helps their underlying disease improve for them. So, the most important thing we can all do is vaccinate. And I think the vast majority, and I'm, up, well above, this 43% or 48% of the patient or the population of physicians across this country are vaccinated. And I heard somebody say, if we really thought that this vaccine had bad side effects, or it was going to kill you, or it was going to make you sick, would we want to vaccinate all of our physician population and wipe them out at one fell swoop? And the answer is obviously not.
No.
I was first in line, raised my hand. As soon as I can get that vaccine, I got that vaccine. I actually got my vaccine on day one of children starting to give vaccines. So it's important to get the vaccine. That's what adults can do for kids.
Yeah.
And masks. And the other thing is, I hate to say it, and it's no fun, but right now with how contagious the Delta variant is,
Mm-hmm.
we need to actually go back and think about how we acted when this all started a year ago, March.
Yeah.
And we go back to it because, the birthday party with everybody there who's not vaccinated is not worth having.
Mm.
I don't know how I would feel if I exposed someone who then subsequently got sick, ended up in the hospital and died, when I could have said, I hate to do this. It's delayed gratification, but we got to just go back to really acting responsibly, go back to the concept that you have a pod. If your neighbor kids are going to play with your kids, the adults pod themselves like folks were doing all last school year.
Mm-hmm.
It's hugely important that, between vaccines and doing things to decrease transmissibility, like let's not all gather 40 people for a party, especially when people aren't vaccinated. And then making sure that our kids and adults are wearing masks. We set the example.
Mm-hmm. Parties, birthday parties.
I know, and I miss them. I
do, but I would much rather have my people around me still a year from now. If it means that we cannot have the birthday party, if it means it's just my spouse and my sons celebrating, I think it's worth it. To keep people.
I know it's not fun. I know it's not fun.
Yeah.
And families are back at work, and I get that. They have to be, and kids are in daycare. And the number of kids I've seen that have been in daycare, that are picking up COVID, whether it's from another child in daycare or from, the transmission process isn't completely, figured out. We once thought that it really wasn't a pediatric burden. Like when the virus first happened and virus first came into the US and we're seeing patients, we were not seeing many kids getting COVID. So then we weren't sure what that was. Well, part of it was kids weren't in school. Kids got pulled from school, so they're not there infecting one another. But there was also this thought process that was something about children that they weren't either catching it or they didn't have the severity of disease. But the Delta variant has changed the game. I mean, we're now seeing kids come into the hospital that have the same sort of COVID pneumonia, oxygen requirements that some adults have. Some of them have underlying other illnesses, but some of them are just your average kid, and they're getting admitted to the hospital because they have oxygen needs and they have COVID pneumonia, and they're 2 years old. So everything that we can do, and there's not a lot. That's the hard part. The vaccine, distancing, hand washing, mask wearing, really important. And being a pediatric ER doctor and basically working in quote sick daycare as it were. I mean, every kid has germs when they come in to see me. But how over time I've helped myself is it's really, really important not to rub your eyes, rub your nose, touch your face. So wearing a mask actually helps keep you from doing that. But it's hugely important because you can never be perfect about your hand washing. It's just impossible. But rubbing your eyes, rubbing your nose, touching your face, that's how you get virus on your hands and communicate it to yourself. So that's huge tip of the trade to try to avoid getting sick. And if you think about it, you realize how often you do it.
And I'm looking at myself and I'm we
but
do it.
But if you put that in the forefront of your mind and you put a mask on, sometimes those are ways to change your habit. I don't let myself rub my eyes. It helps that I wear glasses because it's too hard to do it. But that's a huge one.
What are some myths? What are the three biggest ones you've heard?
Oh, I've heard all kinds of them, but I've had people tell me that they heard that people with the vaccine are dying more than people that don't have the vaccine, and that's absolute 100% myth.
Mm-hmm.
The other is that I've had people tell me that pregnant women shouldn't get the vaccine, and that's absolutely not the case. The Center for Disease Control, the American College of Obstetrics and Gynecology, they've all said that women should be vaccinated. And actually, there have been newborns that they've tested, that the mother has been vaccinated, and they've tested the newborn's blood, and the newborn has antibodies against COVID.
That's wonderful. Awesome. That's
great. So the vaccine itself doesn't cross the placenta, but the mom's antibodies that she's conferring to that baby in utero are crossing and getting to that baby. Hugely important. That's, another way to protect infants. Every single one of my colleagues who was pregnant got the vaccine at the get-go.
Yeah.
So they firmly believe, the last thing you want to do is get COVID while you're pregnant and have a horrible outcome. Horrible outcomes. There's stories out there. They're not myth.
Yeah.
So those are big myths. The whole thing of, there's some chip and mind control and all that, I just roll my eyes at. The government's going to somehow be able to control me with this vaccine, or that it's going to change your DNA. It doesn't change your DNA. It can't change your DNA. It's not that type of a vaccine. And the vaccine is really safe. It's been being worked on for over 20 years, primarily from the work being done in the HIV world of trying to be able to vaccinate against HIV, and from years back when the SARS virus hit in. So work towards a coronavirus vaccine has been happening. And it just happened to be that all the power and money that could come forth worldwide to try to create a vaccine against this disease came to bear, and the technology was already there.
Mm-hmm.
So people that think this vaccine was rushed, it wasn't rushed.
Thank you for saying that.
Yeah, it was not rushed. This was strong science that was being worked on for a good while.
When is an emergency room visit warranted?
Yeah, that's a tough one because people are scared. Kids that are having a hard time breathing, kids that are having a hard time keeping down fluids so they can stay hydrated. I tell families, when your child's sick, I'm not worried if they eat. They'll pick up their appetite when they feel better. Their job is drinking and peeing. I want kids to stay hydrated. So staying hydrated. So, any difficulty breathing, certainly any color change, like they become blue, they're having a hard time oxygenating their blood. Those things are an automatic. But if they can't keep down fluids and keep themselves hydrated, and my rule is you gotta, for little itty bitties, you gotta have at least one wet diaper every 4 to 6 hours, knowing that your kid does way more than that, but that's my bare minimum. Kids can make tears, they've got saliva in their mouth. Those are reassuring things. No, they don't feel good and they're not themselves, but they're not at a point where they need to be emergently seen. At the same point in time, I would never tell a family that if you are so worried about your child that you shouldn't bring them to me. That's, bring them. I mean, this is not a don't bring your child to me. If you're worried about your child, bring them. But there's right now with the kind of volumes that are being seen in the ER, and if your child, when they come into our triage and they get seen and they've got a normal oxygen rate, a normal breathing rate, their vital signs don't tell anybody that they're really dehydrated, then they're going to sit more towards the back of the line to be seen by us. And you may be waiting a good while. And to the point that, we're telling folks, please know that when you come to the ER, it's not a first come, first serve situation. The sickest child gets brought back next. Yeah. And even though you know your child and they are sick to you, we are looking at them as sick in general. We understand that you love your child and they're sick, but there are kids that are sicker than your child that may come back, get seen faster. So
go ahead. I'm sorry.
No, that's fine. That's it.
Where can children get tested?
Yeah, there's testing sites all over the city. So, and I do know that Children's Healthcare of Atlanta on their website has a list of testing sites. So if you go to choa.org /testing, you can find sites throughout the city. But the other thing is there are now COVID testing tents set up in the parking deck areas and the parking lot areas at the Scottish Rite campus for the ER, the Hugh Spalding campus for the ER, and the Eggleston campus for the ER. And you can walk in and just get COVID tested there. So that's an opportunity as well.
Okay. Thank you for that information. This is a lot to consider, but at minimum, or not even at minimum, at the most, our best practices are, if we are eligible to get vaccinated, get vaccinated.
Please.
Wear masks.
Absolutely.
Limit social gatherings. In fact, don't have any, is what you're saying.
Yeah, I mean, small, and I understand, you've got family members, say you've got elderly parents, and they're vaccinated and you're vaccinated and nobody has symptoms, that you can decide on your own if you feel comfortable that that's safe to gather together or not. I will say that I have gathered in those scenarios with people, not always in close contact, sometimes outside. So, but if you have people that are not vaccinated and they're around you, the hard part is the vaccine's not perfect, just like the flu vaccine's not perfect. So being vaccinated, it doesn't mean that you absolutely 100% are not going to get COVID. But what it does mean is the chances of you being hospitalized or ending up in an intensive care unit are minimal. They're very, very low. Now, that doesn't mean that there aren't some breakthrough cases that have that happen. That should not be the reason to not be vaccinated. I've had somebody tell me that, oh, I know somebody who's vaccinated and they ended up in the hospital. I said, okay, they're in that small percentage. At the same point in time, they also hopefully have some antibodies in their system that are also helping them fight this illness. So it's important, if you're going to be around folks, like say you've got to help with an elderly parent or something like that, that they're vaccinated, you're vaccinated. Whether or not you choose to wear a mask in that environment is your choice. I would probably tell you it's worth doing. I know churches are back to wearing masks, even though a lot of the congregation are actually vaccinated. What you're doing is helping to protect someone else as much as you're trying to help protect yourself.
We are loving our neighbors as ourselves.
Yeah, there's a social contract here.
Right. Social contract. I like that. Final thoughts.
I just want folks to do all they can to take care of themselves and their family, and to realize that there are few tools that we have, but use every single one that we have to its max. I mean, if you're going to be eligible for a booster vaccine, get your booster vaccine. If you haven't been vaccinated, get vaccinated. I've got colleagues and friends who have their children enrolled in the studies so that we can go down below 12 years of age. I mean, I'm hopeful that that vaccine is going to roll out. And the other thing is, get your flu shot. So not just the COVID vaccine, but we didn't see a big wintertime flu season last year because we were quarantined and home and not exposing one another. The flu season this year, who knows what it's going to be like. But I have seen children who have died from influenza who are normal, healthy children. And it broke my heart. And they weren't vaccinated. So the same lore, the flu vaccine doesn't give you the flu. It may make you feel bad for a day or so. That's your body's immune system doing its thing. You cannot get the flu from the vaccine. It is a safe vaccine. It is not a perfect vaccine, but it is the best we've got, and you're better off having it than not.
Mhm. Mhm.
And just take care of one another, love one another, think
Love
about
one.
how your actions affect other people. And as I
Mm.
tell people all the time, be well and be kind.
And as I tell people all the time, be well and be whole. Dr. Beth, thank you so, so much for taking the time to talk about this important issue. We will continue to pray for you and others in the field who are on the front line doing everything. I know you're tired.
Everybody's
Um,
tired.
yeah.
We're
And
short
we,
staffed. Everybody's tired.
well, we are continuing to lift you up all that we can. And I know that sounds, even in saying it, it feels so small
No, it's
compared to
huge.
the task at hand, but we
It's huge.
appreciate you. We appreciate you and all that you do.
Well, I thank you for the opportunity to educate folks and to help
Mhm.
folks and to hopefully dissuade some fears and concerns. If you need us, we're there.
Thank you.
Thank you.
Be well, be whole, people. Bye.